Thank you. Hi, everyone. We're here today for an office hours for the Community Health and Healthy Aging Funds. We'll be talking today about the application questions and developing your application, as well as an open Q&A period as well. If you do need live transcript, it's available to you. We'll let you know in the chat as well. You can click the more button down below and then live transcript. And otherwise, if you have questions throughout the session, please drop them in the chat for us. That helps us keep track of them. And you can also unmute as well and ask a question. But without further ado, we can get started with sharing some content. My name is Emily Breen. I'm a program officer for the PSC funding opportunity. And I'm also joined by two colleagues, albeit Altine Gibson, who's the director for the funds, and Chen Hens, who's the program coordinator for the funds. We'll spend a few minutes today going through just some brief content about the application questions and developing your application, and then we'll try to leave a bulk of the time for questions and answers that you have for us. So we want to start by talking through some of the application questions. There is a distinct set of questions for each of the three funding streams, but many of them are similar. So we're going to talk about the ones today that span across all three of the funding streams. So the first thing we'll ask you about is your approach. This is the longest section and really gets into the details of what you're proposing to do with these funds. So we really want to encourage you to spend time here to ensure you're communicating clearly what you want to about your proposal and what you're proposing to do with the funds. So there's a few questions here. We want to understand what specific PSC change, policy systems, and environmental change you're hoping to achieve with these funds, or a set of activities that you would be doing for the CHIP process if you're applying for that funding stream. We also want to hear what you're thinking about how this approach will address the root causes of health outcomes. And I think also the next couple questions are asking about really how you see the impact of this work being. So what do you hope to accomplish by the end of the requested grant period? And how do you know if you're successful? So we really want you to define what success would look like for this approach, and then think through how you would measure that success. And we want to highlight too that you may have initial ideas, and funded grantees will also have support from our evaluation team to continue thinking through how they measure success. The next section is community engagement. So the funds really focus on community-centered approaches to policy systems and environmental change and to addressing the root causes of health outcomes. So we really want to emphasize this piece about how you're engaging the community that you hope to impact or benefit. So first, we want you to help define the community members that you are working with. So community can look a few different ways. It could be a geographic area, a population-based community, or even a mix of both. And we want you to help explain and help us understand what that community is for your proposal. And then also dive into how that impacted community is engaged in your work, whether it's through leadership, design, or even implementation of the work that you're proposing. The third section is applicant and partners. So asking a little bit more information about your organization and the partners that you're working with. And we want to emphasize here that we are really, the funds, as you know, are committed to equity. And so we want to learn a little bit more about your commitment to equity. So some of the questions we ask are, what are your current efforts or your partner's current efforts or plans to incorporate equity into your organizational policies and practices? Also, we would love to understand your organization's leadership and how decisions are made within your organization and what role different stakeholders play in that process. And lastly, we are really looking to fund organizations that are based and embedded in their communities and also reflective of the communities they're serving. And so we'll ask you to share some information about how your staff and leadership reflect the communities that you propose to serve with this funding. So I know that was kind of a lot. We want to pause here actually and give you all a few minutes to review these questions and also take a look at the specific questions for the funding stream you're considering applying to. So I think we'll give you maybe 3 to 5 minutes to review those on your own. We'll drop the links in the chat for you. And then we'll pause and do some Q&A before we continue to talk a little bit more about the application formats. So if I can have help from Aviad and Chen to drop those links for everyone, we'll take until maybe 10:25 to review those, and then happy to answer some questions. You can restart. Thank you. So we have one question that came through in the chat that I can start with, and then happy to answer other questions as they come as well. This is definitely a question we've gotten before about the distinction between the PSE funding stream and the CHIP funding stream. There's a few distinctions that we make on the funds. So community health improvement planning can be a really broad idea of how, we do work that improves community health, basically. But we also think about the CHIP planning as a pretty distinct process as well. So you may be familiar with nonprofit hospitals being required to contribute or complete a community health planning process every 3 years. So CHIP planning is often connected to that requirement that hospitals conduct. So that's one distinction, and is those CHIP processes are usually connected to that sort of formal process that hospitals go through. And also CHIP is a sort of systematic approach with multiple partners and stakeholders contributing to community health improvement, usually broadly in a municipality, a city or a town, or a region, more a broader region as well. Typically, it's not as much of like a single organization doing community health work. Rather, it's sort of a systematic approach with several different partners coming together to address problems that were identified through the community health assessment that the hospital conducted. So that's sort of some of the distinctions we make between CHIP and PSE. That would be kind of you could do PSE changes, you could address similar health outcomes in CHIP processes as you would PSE, but it's often connected to that more broad approach with several partners, really that systematic approach that would be conducted in a city, a town, or a region. So I hope that helps, but happy to talk through anything with that further. If there's any particular questions related to that, but also if there's other questions coming up, feel free to put them in the chat or come off mute and let us know as well. Yeah, another great question. Should our collaborations be with hospitals or organizations who are all in healthcare? You definitely don't have to only collaborate with healthcare or health center organizations. Happy to see that collaboration as well, especially with the CHIP process. But for any of the funding streams, we encourage collaboration with any sort of community-based organization that could be involved with addressing the social determinants of health or the root causes of health outcomes, which, as we know, can be really broad. For example, the built environment or housing being a social determinant of health. There might be a housing organization that doesn't explicitly focus on health, but does have a significant impact on health outcomes through their work. So want to encourage all sorts of different collaboration, and we would really love to hear in your application how your partners are contributing to the work that you're proposing to do. I hope that helps. Other questions about the questions?
When you say what is the specific policy or system you want to change, do you have to actually name it, or like be like Massachusetts general law, whatever is what we are looking to tackle?
Yeah, that's a great question. So it could look a few different ways. I think I would definitely recommend for anyone who wasn't able to join the PSE specific training that we did, that might be a helpful place to start. When we talk about PSE change, it could be advocating for a particular policy, but it could also be advocating for more generally like policy change for, I'll give you an example of a current grantee. They are advocating for a change in policies for people with a criminal record to access housing. So that might span several different policies. So really they're working towards that sort of broader policy change related to those topic areas, not necessarily like a specific bill, if that makes sense. So certainly we want you to kind of define what makes sense between the policy systems or environmental changes. And again, it could be pretty specific or it could be a little bit broader and aim to address several different areas. Where we can link, oh, thank you, Chen Chen. We're going to be sharing the slides, and also on that apply page that Chen Chen just added in the chat is previous recordings as well. So that PSC recording might be helpful for folks. Thanks for that question. Yeah, I see your hand raised. Go ahead. I think someone just came off mute for Fitchburg Housing. We may be having trouble hearing you. So feel free to also drop your question in the chat. I'll go ahead and answer this next one in the chat as well. Great. Alden. Thanks, Lindsay, for the question. It sounds like you're reaching a community across many different areas of this state, and a few, but not all of them, are rural. It's a good question. Does that put us at a disadvantage for those that may not know? The Healthy Aging funding stream is prioritizing communities in rural areas and gateway cities. I think, Lindsay, we'd want to learn a little bit more about the community that you're looking to serve. There's several different, elements of community that we're looking for in your proposal. So the gateway and rural areas are a priority. So certainly if there are applications that are reaching those particular areas, they would receive priority. But we also want to learn about, other ways that you're defining your community and the population that you're reaching. And so I can't necessarily say that your application would automatically be at a disadvantage because it doesn't reach only rural areas, but certainly we would prioritize those that do. I hope that's helpful, but of course, lots of different elements and review criteria that go into the applications. Thank you. I'm just reading this next question that came in the chat, and happy to have my team jump in as well. Thank you. So you're working together and collaborating with two partners on a proposal. Can each organization apply for the maximum $100,000 for the Healthy Aging funds? This is a great question. We addressed some of this in the FAQ, and we're happy to add more detail, but I can answer it now as well. I think what we would say here is that if you're applying for one project in one single application with several partners, you cannot receive more than the maximum. So you would only be able to receive 100,000 per year for up to 5 years for the Healthy Aging Fund. If you need more than that to implement the program, you might consider submitting separate applications for the different partners for the elements of the work that you're each conducting, but we can't guarantee that all of the proposals will be funded, even if one of them is selected to be awarded. So I think it kind of has to, you have to consider what might be best for your organization and your collaboration in terms of submitting one combined application where you can only go up to that maximum, or several separate applications. And again, I want to emphasize the maximums are per year. So you can request 100,000 per year for up to 5 years for the Healthy Aging Fund. And then there's slightly different maximums for PSE and CHIP. Thanks, Juliet, for your question in the chat. Um, we don't define specific cities and towns for priority for this funding cycle, but we are prioritizing certain regions. It sounds like you may have seen that the Middlesex County area is some of that area is included in the priority regions. And so I think basically, like if you are addressing some communities in the priority areas and some not, like another question that came up earlier, there's a lot of different factors that will go into reviewing the applications. And so I can't say for sure that that would like disadvantage or advantage you, but again, we will prioritize those areas that we've listed in the application and also consider all of the other elements of your application. And I'm just reading the second half of the question. If you apply for the full amount and we feel you're not a fit, can we have less or automatically not funded? This is a good question as well. We've gotten something similar in other sessions. There is an opportunity for sort of conditional funding. So we may be reviewing applications and decide that we'd like to fund someone because they have a really strong approach and are addressing a priority community, but there might be elements of the proposal that we aren't able to fund for some reason. In that case, we might have sort of conditional funding and go back to the applicant and say, you know, we can fund you at this amount and have them sort of agree to that. I think in terms of the specific question of if we feel someone's not a fit, in that case, I don't think we would be funding at all. I think we'd really want to be focusing on using the limited funding for those that we feel have the strongest approaches to address PSC change and the root causes of health outcomes. I hope that helps. And if my team has anything to add, feel free. Maybe what we can do at this point, I know that I'm sure there's other questions coming. Maybe we can finish up the brief couple more slides that we had to share with you all, and then we can use the rest of the remaining time for any additional questions. So Chen, if you don't mind resharing the slides, thank you. We just wanted to highlight for you all. So we just talked a little bit about the application questions and you got a chance to review those. We want to highlight just briefly the formats that you can use to answer those questions. So you may have already seen this, but we're just going to talk through a few different things related to this. First of all, there's 3 different format options for you all. So you can choose one of these formats to address the full set of questions for your funding stream. So you might want to use a narrative, which is just written, could be a Word doc format, written narrative to answer the questions. That would be a maximum of 7 pages. You could also do a slide deck. So you could answer the questions using a bit like I think a slide deck could be used for kind of a combination between some narrative and some visuals as well. And the maximum there is 20 slides. And then the third format is a video. So you could do a video that's up to 15 minutes long. And just one thing we wanted to address here, we got some questions in another office hours session about like blending the different formats. And so we have some recommendations there. I think if you want to use minimal visuals, you think that will add to your application and really communicate something in a way that narrative might not, but you want to do mostly narrative, you could add some visuals to the narrative, but we'd still ask that you stay within that 7-page maximum. If you have more visuals that you want to use that might not fit within that format, but you want to have a combination of narrative and visual, we'd recommend the slide deck format for that. And then lastly, if you have any sort of video content that you think would add to your proposal, we would recommend using the video format, and you could still do a combination of perhaps like voiceover of a presentation as well as some other video content as well. So there's an opportunity in each of these to do a bit of a combination of different formats, but we ask that you choose one and stay within that maximum to answer all of the questions. I think that's it for me, so I'll pass it to you, Alviette. Thank you.
Thank you, Emily. And I will work through these next few slides so that we can get back to some of the questions. And again, thank you all for coming through despite some of our initial technical difficulties. Going back to talking about some of the narrative piece, in terms of some tips for you for submitting that, we're asking that you use 12 point Times New Roman font with the 1 inch margin. Although some folks, what they do is they can do it on a Word first and then transfer over the document, the written text into the specific sections within the application, the Blackbaud application form that we're using. We're asking that you answer the questions in order and include the name of your initiative and the name of your organization on the first page and in the document footer as well. And we do have word count for each of the questions. However, they are just meant as a guide for you to kind of give you a sense of how much we're asking for and the page limitation that we have. Next slide, please. As it relates to tips for submitting your PowerPoint, again, we are asking that you try to answer the question in order, that you include a title page, which includes the name of your project and your organization as well. And try to use fonts that's easily readable as well, thinking about the audience so that they're able to see what you have on the slide deck. Develop short sentences or a list of key points as well that you want to highlight throughout your presentation. If you want, you can certainly use art, pictures, graph, different types of things to try to convey your message. Also create clear labels for charts and graphs, because again, that's going to be helpful for the audience, especially if you are not doing a hybrid of presentation and slide. So that you're making it as you're conveying the points as clear as possible. Make slide background subtle and try to keep them consistent so that people are able to focus in on the message that you're relaying. Use high contrast between background and text color. Again, this is to help assist with people being able to see the visuals. And when you are saving your PowerPoint, just make sure that you save it as funding opportunity and then your organization's name in order for us to be able to be clear on who this particular PowerPoint belongs to. Next slide, please. For creating a video, again, some of the tips for that is answering the question in order. In the description, list the title of your initiative, the name of your organization. We think it'll be helpful too if you're able to draft the script or outline for your video. And if you're filming yourself or someone else speaking, try to find a steady surface for the camera, whether it's a camera that you're using, a phone, iPad, whatever the case may be, in order to, again, continue to help us focus on the individual presenting and what's being stated. Light your recording area and maintain a non-distracting background as well. Speak into the microphone and, if possible, to get as clear of audio as possible. And you might want to consider also recording multiple takes and a few videos, and you can choose which one you think makes the most sense. And if you happen to have the recording wizard, certainly you can chop things up and put them together as well. In the description sections, consider listing stopping points for each of the questions. So, for example, if you're doing the background, you may say, the background can be found at, the 3-minute, 15-second mark. And then you'll upload the video to YouTube and publish it as unlisted. If at any point during this time you also have trouble with doing that, you would need to please just contact us in the email that we've provided within the website, the CHHAF funds at hria.org. Some other tips as well is just ensure your proposal is as clear and concise as possible. And if it's at all possible for you as well to consider asking some colleagues to read it as well. And if you have colleagues who, aren't quite familiar with your work, that's great as well, because you want to see if the idea that you're trying to convey, is really coming out and people are able to understand what you're sharing with them in your proposal ideas and to give you feedback. Spend most of the narrative articulating the approach and what your organization will do with the funds as well. That's really important. And we'll talk a little bit about some of that in other next few slides. And really just spell out or say the full names of acronyms at least once. We're all familiar with the alphabet soup, and sometimes we don't all necessarily understand what the acronym stands for. And so it's really helpful to be able to have that spelled out for folks. Next slide, please. And keeping in mind with your applications, there are attachments that you will, that we suggest that you please take a look at and review, on the early onset part of the application process, in case you may have some questions related to that. But as you're thinking about uploading the attachments, the budget and the work plan activities are just additional ways in which, we're trying to understand some of the specifics on your approach and to highlight the work that you're doing as well. So really being mindful of the budget and the work plan activities that you're sharing with us as well. And ensure that you're attaching your W-9 specific documents as well. Next page, please. And when you're looking at your work plan, as you're looking at the work plan, the purpose of the activities, the work plan activities is really to help you operationalize your approach and your timeline and kind of give some depth and breadth to how you're looking at proceeding to do the work. And it's just going to also help the reviewer understand how you will implement the approach that you've outlined in your proposal, in your narrative. And so whether you're doing slides, narrative, or video, please be sure to also complete the work plan activities as well and do all the attachments. Some of the components on the work plan is activities. Basically, you've just given us a brief outline of each of the major activities that you're planning on doing, the time frame, the expected year, months, or quarter that you anticipate on doing each of these. Activity lead, so who is the person that's going to be the primary or others who may be joining you in the work. And community engagement is, the more information about how the community will be engaged in each of these given activities. And so the level of details for the work plan, we're really asking to keep it brief. This is an initial introduction into the work. So by no means are we expecting you to get super detailed with it, but just enough information so that we can see the trajectory of where you're going, especially as it relates to your narrative. Slide. And additional Q&A. So we will take the rest of the time now to answer any other questions that you might have. Again, we're happy to take questions in the chat, or if you want to raise your hands and take yourself off mute as well. One additional piece that we just want to continue to encourage everyone to do is continue to visit the webpage, in particular the FAQ section, because even if we log off soon and you're like, oh no, I remember a question that I should have asked, chances are you may be able to find it in the FAQ section of the webpage. So please be sure to take a look at those. As you're reviewing the questions and the documents, take a look at the FAQs if something comes up, because you may be able to find answers to some of that question. And we have a question in the chat. We have an affordable housing project that is an intergenerational model in Athol, and wondered if that might be a fit, realizing you have little information. So thank you for that question. And so what we would say is that housing is also one of the social determinants of health that would fit under the work of the funds. However, we are asking folks to really just think upstream in terms of what it is that you're looking to do within your specific project. And so, but certainly thinking about that particular social determinant of health is something that we are looking to address within the funds. I don't know if anyone wants to add anything additional to that. You're welcome.
Can I go ahead and ask? Okay, hi everyone. So we are more into mental health improvement. That's why we are looking more at CHIP. And we are organization that our community believes a lot in its little leaders, not little as small, but whichever group we belong to, we always tend to belong to different groups, and our community works that way. So we are planning to we're already doing it indirectly, but now we want to make it stronger and make more sense and more sustainable. And so supporting these already existing groups, looking at their barriers, heard from all the, we plan to make let me use the word think tank because it's a cool word nowadays. Imagine working with all those little groups which each group leads around 200 families. And you get just always one person from there, and you create a think tank which addresses those different organizations. And then looking at the barriers, working with the community leaders. And that's where we are thinking, do we fit in CHIP? I mean, I feel we fit, but I might be wrong. I don't know.
Thanks, Juliet. That sounds like a really exciting project. I think, first of all, it sounds like you're focusing on mental health, which could certainly fit in eligible for any of the 3 funding streams in terms of the topic area. In terms of the approach, it's hard to say just hearing a little bit about it. I think that there's potential for that to fit in PSC as well. So for example, some of our current grantees in the PSC funding stream are doing similar sort of general activities in terms of partnering with several different community-based organizations and groups in their town or region to think about systems change and addressing the sort of same sort of community engaged work that you're talking about. And so I think going back to sort of that distinction between CHIP and PSC, there's definitely some similar elements. I think PSC and CHIP grantees in both of those sections are partnering with a lot of different stakeholders in their community. The distinction we see with CHIP is that it's often that really formal process following a community health assessment that the hospitals conduct, and then sort of a documented plan that different stakeholders are implementing. Whereas PSC might have similar elements to that, where you're kind of responding to community needs and developing a plan to address those needs with different community partners, but it might look a little bit less formally connected to that sort of CHIP process, if that makes sense. So I think there's an opportunity to fit in either one of those funding streams.
So
But-
maybe we go ahead and start writing on, and then along the way,
Yeah.
we will need to, I think we need to read both questions for, and then we see
Mhm.
where they kind of go off.
Yeah, I
Because
think,
some things are seeming to be similar. We felt like policy, are we policy or are we like it was anyway, yeah. So this is helpful, but just so we are in that area, so we are trying to kind of decide which one.
that sounds like a great approach to sort of start writing and then see which questions are matching up. And I definitely encourage you to take a look at the PSE training if you haven't been able to, because it helps sort of ask some prompting questions about policy systems or environmental change to help you identify if your work sort of falls into one of those particular areas. So that might be helpful as well.
Cool. Thank you very much.
You're welcome. Thanks for asking.
One piece, oh, I'm sorry, Chin. One piece I just wanted to add very quickly was certainly as a reminder for folks that we do have the different, the previous awardees. We have some example of PSE work, CHIP work, as well as healthy aging, which might also be helpful to see, especially as you're grappling with whether you're moving towards PSE or more of a CHIP related project.
Yeah, I was just going to add something additional that PSE is not only focused on policy change and also system and environmental change that Emily just mentioned, like the system change, including like social norms of organization, institution, or system, and or environmental change, including like physical, social, economic, environment change. So it's not just help like to change the policy level.
Thank you. I think Emily just sent in the information on where you can find some of those examples as well in the link. We have a couple more minutes to hang out with all of you. So happy to take additional questions. And again, if you aren't able to think of it at the moment and you think of it later, you can feel free to email us in our email address or check out the FAQ. All right, we just want to continue to want to once again thank you all. We look forward to seeing your applications come in. Please take a look at some of the previous recordings as well. Yes, we're very excited to see what is to come. Oh, I'm sorry, there's one question. I'm sorry, this was asked already. Will this be available on the website? If so, where? And if you're referring to this recording, yes, it will be available on the website, and we will put that in the link for you. All right. Thank you all. We hope you have a great rest of the day and an even better rest of the week.